Have you ever felt a strange, unexplained feeling in your body and wondered if it was something serious? The truth is, certain warning signs should never be ignored because they could mean your body is running out of time. When doctors see these symptoms, they know that something life-threatening could be just around the corner. In this video, we're going to talk about 6 warning signs that doctors say could mean the end is near. These symptoms may seem harmless at first, but if you experience them, they could be telling you something very important about your health. From sudden tiredness that won't go away to a deep, sharp pain in your chest, each of these signs is your body's way of crying out for help. Stay with me until the end because this information could literally save your life. By knowing these warning signs and acting fast, you can take control of your health before it's too late. Now, let's get started. Number 1. Unexplained extreme tiredness. There's a big difference between feeling tired after a long day and experiencing a level of exhaustion that seems to have no cause. If you feel completely drained even after a full night's sleep, or if daily activities suddenly feel impossible, it could be your body warning you that something is seriously wrong. This kind of tiredness isn't something you fix with a cup of coffee or a quick nap. It lingers, weighs you down, and most importantly, has no clear reason. Maybe you used to go for daily walks but now feel exhausted after just a few steps. Maybe simple tasks like cooking, getting dressed, or even having a conversation feel like too much effort. This isn't just aging. It could be a sign that your organs are struggling, your heart isn't pumping as it should, or your body is shutting down essential functions to save energy. Doctors see this all the time, especially in patients with heart disease, kidney failure, or even advanced cancer. When your body is using everything it has just to keep going, the tiredness becomes overwhelming. It's not normal, and it's not something to ignore. One of the biggest warning signs is when this tiredness suddenly appears or gets worse over time. If you used to have good energy, but now feel weak and drained without a clear reason, that's when you need to take action. Your body isn't just tired, it's warning you that something deeper is happening. So what should you do? Pay attention to when this tiredness started, what makes it worse, and whether it's stopping you from doing things you once enjoyed. If it's getting worse and interfering with your daily life, it's time to see a doctor. The earlier you act, the better your chances of finding out what's wrong and stopping it before it's too late. Number 2. Sudden and severe chest pain or pressure. There's one feeling you should never ignore: a crushing, squeezing, or intense pressure in your chest. If this happens suddenly, especially if it spreads to your arm, neck, jaw, or back, you could be seconds away from disaster. Doctors warn that chest pain like this is often a sign of an imminent heart attack or a deadly aortic dissection. Many people make the mistake of brushing it off, thinking it's just heartburn or a muscle strain. But when a doctor hears about this kind of pain, they don't take chances because waiting too long can mean the difference between survival and tragedy. The most dangerous kind of chest pain feels like a heavy weight pressing down on you, making it hard to breathe. It may start slowly and get worse over time, or it may hit you like a sudden punch to the chest. Either way, it's your body screaming for help. Here's what you need to know. Heart attacks don't always look like the dramatic scenes in movies. Sometimes the symptoms are mild, just a discomfort in your chest or upper body, combined with nausea, dizziness, or sweating. That's why many people ignore it until it's too late. And if the pain is sharp, tearing, or feels like something is ripping inside your chest, it could mean your aorta, the body's largest artery, is tearing apart. This is one of the deadliest medical emergencies and requires immediate surgery to prevent fatal internal bleeding. So, what should you do? If you ever feel sudden, severe chest pain, don't wait. Don't lie down and hope it passes. Don't convince yourself it's just stress. Call emergency services immediately. The faster you get medical attention, the better your chances of surviving. If you're still watching this video and finding these insights helpful, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I highly recommend you subscribe and turn on the bell so you don't miss any future videos. Your support helps us keep creating valuable content to inform and inspire you. Now, let's move forward. Number 3. Difficulty breathing or shortness of breath. Imagine this. You're sitting in your chair, not doing anything strenuous, but suddenly, you feel like you can't catch your breath. It's as if the air has suddenly become thinner, and no matter how deeply you inhale, it's not enough. This isn't just discomfort, it's a major red flag. Doctors warn that unexplained shortness of breath is often the body's way of signaling that something critical is failing. It can be a sign of advanced heart failure, a dangerous blood clot in the lungs, or even a silent heart attack. Many people assume that trouble breathing is just a sign of getting older, but when it comes on suddenly or gets worse over time, it's something you can't afford to ignore. One of the most life-threatening causes of sudden breathlessness is a pulmonary embolism, a blood clot that travels to your lungs. This can happen without warning, especially if you've been sitting for long periods or recently had surgery. The scary part? It often starts with just a little discomfort, maybe a feeling of tightness in your chest, and then suddenly it feels like you're suffocating. Another possibility is congestive heart failure, where fluid builds up in your lungs because your heart isn't pumping properly. This makes it harder to breathe, especially when lying down. Some people even wake up gasping for air in the middle of the night. And then there's a warning that's often ignored: a silent heart attack. Unlike the usual crushing chest pain, this type of heart attack appears as extreme shortness of breath, nausea, cold sweats, and an overwhelming sense of tiredness. Many people don't realize they're having a heart attack until it's too late. So, what should you do if you ever feel short of breath for no clear reason, especially if it happens suddenly? Don't wait. Sit down, stay calm, and seek medical help immediately. If it's a clot, a heart problem, or a serious lung condition, acting fast could save your life. Now let's talk about another silent but deadly warning sign: drastic and unexplained weight loss. Number 4. Drastic and unexplained. Weight loss. Losing weight without trying might seem like a good thing until you realize it could be a serious warning sign. If the pounds are dropping and you haven't changed your diet or exercise routine, your body could be fighting something much more dangerous than you think. Doctors warn that rapid, unintentional weight loss, especially in older adults, can signal a serious illness. One of the biggest causes: cancer. Certain cancers, particularly those of the pancreas, lungs, or digestive system, can cause sudden weight loss before any other symptoms appear. This happens because cancer changes the way your body uses energy, burning through calories at an alarming rate. But it's not just cancer. Drastic weight loss can also be a sign of severe metabolic disorders, undiagnosed diabetes, or even heart failure. When your body isn't absorbing nutrients properly, muscle and fat begin to disappear, leaving you feeling weaker, more tired, and increasingly frail. If your clothes feel looser, your belt needs to be tightened more often, or people keep telling you that you look thinner, even though you haven't tried to lose weight, it's time to pay attention. There's another reason this happens, one that many people don't think about: chronic inflammation and infections. Your immune system works overtime when your body is fighting an illness, burning through energy stores and causing weight loss without you realizing it. Conditions like tuberculosis, chronic infections, or autoimmune diseases can drain your body's resources, leading to sudden weight loss that seems to have no cause. So, what should you do if you've lost more than 5% of your body weight in a short time without trying? It's a red flag. Don't assume it's just part of getting older. Schedule a medical checkup, get your blood tests done, and demand answers. The sooner you find out the cause, the better your chances of stopping something serious before it's too late. If you're still watching this video and finding these insights helpful, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I highly recommend you subscribe and turn on the notification bell so you don't miss any videos. Your support helps us continue creating informative content for you. Now let's move forward. Number 5. Confusion, disorientation, or sudden personality changes. There's something deeply unsettling about feeling like your own mind is slipping away. If you or someone you love suddenly starts forgetting things, getting easily confused, or acting differently for no clear reason, it could mean something serious is happening inside the brain. Doctors warn that sudden mental decline, especially when it comes out of nowhere, can be a sign of a stroke, brain infection, or an advanced neurological disease. A stroke, for example, can cause sudden confusion, slurred speech, or difficulty recognizing familiar faces and places. Some people experience a brief moment where they seem off. Then minutes or hours later, they appear completely fine. This could be a transient ischemic attack, a mini-stroke. A serious infection can also trigger sudden disorientation, especially in older adults. If someone suddenly seems distant, agitated, or struggles to hold a normal conversation, it might not just be old age. Infections can spread quickly through the body, affecting the brain and causing delirium, a state of confusion that can appear overnight. And then, there's the possibility of Alzheimer's or other forms of dementia. While these conditions usually develop over time, some people experience a sharp decline all at once, losing track of time, forgetting recent events, or struggling with basic tasks that once felt easy. One of the biggest mistakes people make is assuming that sudden confusion is just a normal part of aging. It's not. When the brain starts malfunctioning quickly, it's often because of an underlying medical issue, one that could be deadly if ignored. So what should you do if you notice sudden changes in memory, behavior, or awareness? Get medical help immediately. Whether it's a stroke, an infection, or something else, these are not symptoms to overlook. Acting fast can make all the difference, because when it comes to brain health, every second counts. Now let's talk about the final, and often most, painful warning sign: severe and persistent abdominal pain. Number 6. Severe and persistent abdominal pain. A stomachache might not seem like a big deal, but when the pain is deep, sharp, or refuses to go away, it could be something much more dangerous than simple indigestion. Doctors warn that severe abdominal pain, especially if it comes on suddenly or lasts for hours, could mean something. Inside your body is breaking down. One of the most serious concerns is a ruptured abdominal aortic aneurysm. This happens when a weakened section of the aorta, the body's main artery, bursts, causing internal bleeding that can become fatal within minutes. The pain is often described as a deep, unrelenting ache in the stomach, lower back, or sides, sometimes pulsing with every heartbeat. If this happens, immediate emergency care is the only thing that can save your life. Another life-threatening cause of severe abdominal pain is intestinal blockage. When blood flow to the intestines is suddenly cut off, it can happen due to a twisted bowel, a dangerous clot, or even advanced cancer. If your stomach feels swollen, hard, or tender to the touch, especially if you haven't had normal bowel movements for a while, it's a serious warning sign. Then there's pancreatitis, an inflammation of the pancreas that can cause intense pain in the upper belly, sometimes spreading to the back. It can come on suddenly and get worse after eating, making even simple meals unbearable. This condition can quickly become life-threatening, leading to serious issues like organ failure if ignored. Some people also experience gallbladder attacks, which cause sharp, stabbing pain under the ribs, often triggered by fatty foods. Many mistake this for acid reflux or gas, but when the gallbladder becomes swollen or blocked by stones, it can cause dangerous infections. So, what should you do? If you ever feel sudden, severe, or unexplained pain in your belly, don't wait. Get medical help immediately, especially if it's paired with fever, vomiting, or sudden weakness. Some conditions need surgery, and delaying treatment could mean the difference between recovery and a much worse outcome. If you're still watching this video and find these insights valuable, please comment number 6 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating helpful content to inform and inspire you. Final thoughts. If you've made it this far, you now understand that your body gives you warning signs long before a serious health problem occurs. The key is knowing what to watch for and acting fast when something feels wrong. Ignoring these symptoms, or hoping they'll go away on their own, can be a deadly mistake. We've covered 6 major signs that could mean your body is in serious trouble, whether it's sudden chest pain, unexplained weight loss, shortness of breath, confusion, or severe belly pain. These are not symptoms to ignore. When something feels off, listen to your body. It's always better to get checked by a doctor and be told it's nothing than to wait until it's too late. One of the biggest challenges as we get older is realizing that our health can change in an instant. But here's the good news. Being informed gives you control. Knowing these warning signs means you have the power to protect yourself and act when it matters most. You don't have to live in fear, but you do need to stay aware. Now, I'd love to hear from you. Have you or someone you know ever experienced one of these warning signs? What did you do about it? Sharing your experience in the comments below could help someone recognize a symptom before it's too late. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts matter to us, so don't hesitate to share them. Reading your comments motivates and encourages us to keep creating content like this. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue making good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.